Hi, everybody. Let's get started. So, our topic for today's webinar is fertility and hormone optimization. And really, my hope is that you'll take away practical yet effective insights that empower you to take control of your reproductive health. And this is really no matter what stage of the fertility journey that you're currently on. So, a quick introduction about myself. My name is Dr. Nikki Sinkner. I am a licensed naturopathic doctor at Natural Choice Medical Clinic located downtown Guelph. In my practice, I have a clinical focus in women's health, hormone health, preconception care, fertility, and then just really overall health optimization. Patient centered, evidence based care is definitely at the root of my practice, and I work with individuals on navigating their own personal health goals through creating sustainable yet individualized plans. So I really wanted to discuss this topic today because, first of all, I'm so passionate about women's health and hormone health and fertility. This is definitely where most of my clinical and educational experience lies within. And then also because infertility is quite prevalent today in our society. So in Ontario, 1 in 6 couples experience infertility at some point in their lives. This is quite a significant number. That's 16.6% of couples. And oftentimes I do find that there's a stigma surrounding infertility that unfairly places the blame on women. But that is not the case at all. So research actually shows that 1/3 of cases related to infertility are related to female factor infertility, 1/3 is related to male factor infertility, and then the last third is unexplained infertility. So it's definitely important to have both partners assessed if having difficulty conceiving. So let's dive deeper into our topics for today's webinar. We'll first go in through detail what a normal menstrual cycle looks like and what hormones are involved. Next, we'll discuss the most common causes of infertility, especially those that I see in practice quite often, and then their associated potential symptoms. Then we'll discuss natural approaches to supporting fertility, and this is relating to diet and lifestyle. And then we'll discuss how to optimize reproductive health through comprehensive lab testing, how to track ovulation, and then botanicals and supplements that may be helpful when trying to conceive. And then ultimately to tie it together when we should be seeking care. So let's get started by looking at a high level overview of what are the key hormones involved in the menstrual cycle. And the next slide will also go through a visual, so that may be really helpful as well. So first we have our follicular phase. This is going to be the first half of the menstrual cycle, and the cycle begins when the pituitary gland releases a hormone from the brain called FSH, also known as follicle stimulating hormone. So follicle stimulating hormone is going to stimulate the growth and maturation of the ovarian follicles, and each of these follicles contain an egg. And then as these follicles start to grow and develop, they start to produce a hormone known as estradiol, which is a form of estrogen. Estradiol plays a crucial role by preparing the uterine lining for possible implantation, and this essentially makes the uterus receptive for a fertilized egg. And then as estradiol starts to increase, it sends a positive feedback to the brain, helping it control how much FSH is actually being released. Now, as we get closer to that middle of the cycle, another hormone is also released from the pituitary. This is known as LH or luteinizing hormone. This hormone surges, and this surge is a trigger for ovulation. That's when a egg gets released from its follicle. And then after the follicular phase, we enter the luteal phase, which is the second half of the cycle. The empty follicle that the egg is released from transforms into what's called the corpus luteum. This produces a hormone known as progesterone. So progesterone is essentially important for maintaining the uterine lining and keeping it thick and healthy for an embryo to eventually implant. If pregnancy does not occur, then those progesterone levels are going to fall, signaling the uterine lining to shed, and then menstruation or bleeding begins, and this restarts the cycle. So day one of the cycle is day one of bleeding. So ultimately, understanding how each of these hormones work and how they coordinate the cycle can really help to identify any hormonal imbalances, which is a key factor in fertility. Okay, now let's go through a visual of what this all looks like. This visual is based on a 28-day menstrual cycle, which is the average length of a menstrual cycle. However, some females may have days or cycles that vary by a few days, which can be completely normal. So here we have our follicular phase. This is where we have FSH that starts to grow and be released from the ovaries here in blue. And then rising estrogen levels here in pink is going to be released from these developing follicles, which again exerts a positive feedback on the brain, specifically the pituitary gland, which releases LH. And this surge occurs at around day 14 of the menstrual cycle. And then this surge also is what triggers ovulation. So here you can see the egg being ruptured from that follicle that FSH was growing and releasing that estrogen from. The follicle that released the egg now becomes what's called a corpus luteum in the luteal phase of the cycle, which releases progesterone. If sperm and egg do not meet here, then progesterone will decrease and then we'll get the menstrual bleeding. And then corpus luteum will degenerate and turn into corpus albicans if pregnancy does not occur. So now I'll give a quick overview of common symptoms that trigger us to think that certain hormones are going to be out of balance. So if there are irregular cycles or short periods, trouble sleeping, mood swings, that might prompt us to think that we have lower estrogen or progesterone, sorry. And then if we have irregular periods with hot flashes, night sweats, vaginal dryness, that may lead us to think that we have lower estrogen. And then high estrogen can cause things like breast tenderness, irregular periods, mood changes, and weight gain as well. And then in the context of infertility, we are concerned about irregular cycles because that will have an impact on ovulation. So that egg being released from that follicle. And whether there is no ovulation, also known as anovulation, or we are ovulating inconsistently each month, this makes it really hard to track ovulation, time intercourse ultimately, and ultimately making it harder to conceive. And then when we talk about hormone testing to assess fertility, it's important to test our hormones on specific days of the cycle to get an accurate representation of what our cycle is actually doing. So on cycle day 3, which is day 3 of bleeding, that's when we want to take a look at our FSH, our estrogen, and then our LH. And then day 21, or 7 days after ovulation, is when we want to take a look at progesterone. So, fertility definitely depends on a complex interplay of hormones, reproductive organ health, and really just overall wellness. So, reproductive health is definitely multifactorial, and there are so many different avenues that we want to explore when we're assessing fertility. And then, in order to optimize fertility and prepare our body for a healthy pregnancy, it's important to address any underlying causes that can be impeding these chances. So let's talk about some of the most common causes of infertility that I see in practice. So polycystic ovarian syndrome, also known as PCOS, is one that you probably heard before. It's one of the most common reproductive hormone conditions impacting 1 in 10 females of reproductive age. And so, under Rotterdam criteria, in order to reach a diagnosis of PCOS, you must meet 2 out of the 3 criteria. So, one, irregular cycles. So, this can vary depending on the individual. This can be cycles that occur once every 3 months, or these can be cycles that vary in length each month. So, one cycle can be 35 days, and then the next month it could be 26. And then signs of hyperandrogenism is another criteria. So symptoms caused by elevated male hormones, also known as androgens. Symptoms that are caused by elevated androgens include things like acne, especially here along the jawline, facial hair growth or hair loss, specifically above at the top of the hairline here. And then the last criteria to diagnose PCOS is 12 or more follicles found in one or both ovaries. This can be assessed through transvaginal ultrasound. And this happens because in PCOS, there's a hormonal imbalance that disrupts the normal development and release of the eggs. So this overall impacts ovulation, making conception difficult. And then when we think about lab findings when investigating PCOS, common lab findings include elevated LH because our body is trying hard to ovulate. Then we may find elevated androgens, so specifically DHEA and testosterone. And then elevated AMH, which we'll touch on later in the webinar. And then lastly, PCOS is actually known as a metabolic syndrome, meaning it can have an impact on our blood sugar regulation, cardiovascular health. And so oftentimes insulin resistance can be associated with PCOS. So next, endometriosis. This is another very, very common hormonal disorder that can impact our chances of infertility. And this is where we have tissue that's similar to the lining of the uterus that grows outside of the uterus. This can lead to very many unwanted symptoms like painful and heavy periods, painful intercourse, inflammation, and then thus fertility issues. Endometriosis often does take quite a bit of time to get diagnosed, and this is partly because the gold standard of diagnosis is laparoscopy, meaning they take a biopsy of the uterine tissue and test that. So it's quite invasive. But ultrasounds can also identify endometriomas or ovarian cysts, which are commonly associated with endometriosis as well. Next, thyroid dysfunction. So this is also another common condition that can impact infertility because thyroid hormones play a crucial role in regulating the reproductive system and overall metabolism. So low thyroid hormone levels can interfere with the release of an egg um, from the ovary, which is ovulation, and this can lead to irregular or absent menstrual cycles, which makes conception difficult. And thyroid hormones can also interact with the ovaries, which can impact the balance of sex hormones. So, when we're looking at symptoms of thyroid, symptoms of an underactive thyroid can include weight gain, constipation, fatigue, cold and dry skin, whereas symptoms of an overactive thyroid can include things like loose stool, weight loss, palpitations, nervousness, and both will have changes in menstrual cycles. Some other causes of infertility or difficulty conceiving can be structural causes. So this can be things like fibroids or polyps. Fibroids are basically non-cancerous tumors that are composed of muscle or connective tissue that grow within or on the uterus. And then depending on their size and their location, they can block the fallopian tubes, they can distort the uterine cavity, and disrupt embryo implantation, and these can all have a negative impact on fertility. Symptoms of fibroids can include heavy bleeding, pelvic pain or pelvic pressure, and then frequent urination. And then polyps, these are often asymptomatic and can interfere with fertility because they can prevent the sperm from reaching the egg, making it harder for an embryo to implant, or polyps can even lead to early miscarriages. Another cause of structural infertility can include pelvic inflammatory disease. This is also known as PID, and oftentimes it's caused by sexually transmitted infections like chlamydia or gonorrhea, or can even be caused by endometriosis. PID leads to scar tissue and inflammation within the uterus, which contributes to overall fertility. And then lastly, as mentioned at the beginning of the webinar, 1/3 of cases related to infertility are male factor infertility. And common causes for males include low sperm count, issues with motility and morphology, low testosterone, and then certain conditions like, for example, varicocele. So this is where there's an enlargement of veins in the scrotum, which overall impacts sperm quality and quantity. So definitely important to have both partners assessed when having difficulty conceiving. Now we'll dive deep into some key natural approaches to supporting fertility. Here we'll specifically discuss nutrition, lifestyle, acupuncture, and then stress management. So, nutrition. How does diet impact your fertility and why is it so important? So, one, it provides vitamins and minerals and other nutrients needed for a healthy pregnancy and optimal health and energy. Two, it helps to support a healthy reproductive tract. Three, it builds important stores for pregnancy, and it provides antioxidants, vitamins, and minerals to help protect the egg and sperm health from damage by free radicals. And then lastly, it helps maintain hormonal balance by delivering the fats and proteins required for hormone production and function. So the diet focused on fertility and hormones should definitely have an emphasis on a whole food, anti-inflammatory diet that's also rich in antioxidants. Ideally, we want to be consuming a variety of fruits and vegetables daily, omega-3 fatty acids through fish consumption at least twice weekly. And if you don't like fish, that's okay. There's always room for supplementation. And then adequate protein intake and healthy fat intake. So depending on somebody's activity level, I typically like to recommend at least 1.2 grams per kilogram of protein intake daily. Some examples of fertility superfoods that I often like to recommend include cruciferous vegetables. So these vegetables are known as hormone cleansers. They contain a compound called I3C, and this helps to eliminate excess estrogen within the body. Cruciferous vegetables that are high in I3C include things like kale, cabbage, cauliflower, broccoli, and Brussels sprouts. Next, berries, very important for fertility because antioxidants will protect the eggs and sperm from any DNA damage while also keeping the reproductive tissues very healthy. And then walnuts, very high in omega-3s, which are very anti-inflammatory, and then also those healthy fats as well. And spinach, so spinach is loaded with folic acid, iron, zinc, and antioxidants, all super important for fertility and hormones. And then lastly, flaxseed. Definitely another superfood. So when ground, flax is high in omega-3 essential fatty acids, fiber, and then also antioxidants. Additionally, we can also tailor our dietary recommendations for specific conditions. So, for example, we know that insulin resistance can be a component of PCOS. So, focusing on our protein intake and low simple carbohydrates in the diet can be often very times helpful. As well, if we have a patient with elevated androgens or those male hormones, we can add pumpkin seeds, which are high in zinc, and then spearmint tea, which are also very anti-androgenic. And lastly, a popular topic, alcohol and caffeine intake. So it's important to limit alcohol consumption as much as possible. For men, it's also recommended to consume less than 4 drinks per week. And then for caffeine, so 200 milligrams of caffeine consumption daily has been shown safe in the research for both pregnancy and preconception. And then if undergoing IVF, very important to abstain from alcohol at least 4 weeks prior to the procedure. Alcohol is super inflammatory, and so definitely something we want to avoid. Next, we have lifestyle. So this is another pillar of health that I often like to work on with my fertility patients, can have a very big impact on hormones and overall health. So first of all, we really want to avoid harmful substances as much as we can. Quit smoking and then avoid exposure to environmental toxins if possible. So for example, switching out for clean household products and personal products because both BPA and PFAS are endocrine disrupting hormones that can negatively impact our cycles and our hormones. And then another recommendation that I often give to my fertility patients is switching out those plastic containers for glass containers. And then exercise. Again, very dependent on the individual. I typically like to recommend at least 120 minutes of moderate to vigorous exercise per week, and then 2 to 3 days of strength training weekly. Um, just a quick note, it is very important to listen to your body. So if you feel very fatigued and exhausted after intense exercise, then it's important to avoid this type of exercise or do it in moderation, as intense exercise can definitely have an impact on our hormone levels. So again, listen to your body. Acupuncture, one of my favorite modalities to use in practice. So, acupuncture can be very beneficial for fertility. It can increase blood flow to the uterus and the ovaries, basically optimizing the uterine environment for implantation. And then, based on this, acupuncture can also improve egg quality by ensuring that the follicles receive sufficient nutrients as well as oxygen. And then we'll discuss this in the next slide, but stress management is definitely key when navigating fertility and optimizing hormonal health because elevated stress can interfere with hormonal imbalance and then menstrual cycles. So acupuncture can be a great adjunctive therapy to support stress levels and overall relaxation. Acupuncture is also often performed alongside IVF and other assisted reproductive technology treatments. Research shows that acupuncture during IVF or around the time of IVF nearly doubles pregnancy rates compared to controls. However, the best evidence is having an acupuncture treatment within that 30 minutes of that ART treatment. So there's a 30-minute window there in that context. Now, stress management. Chronic stress basically maintains our body in a prolonged fight or flight mode. This is dominated by the sympathetic nervous system. And then in this state of stress, blood flow is basically redirected from our reproductive organs and towards essential organs that are needed for immediate survival. And this actually happens no matter what the stressor is. Chronic stress also suppresses the production of gonadotropin releasing hormone, also known as GnRH, and this leads to lower levels of that LH or luteinizing hormone and FSH or follicle stimulating hormone. And like we talked about, these are both very essential for healthy ovulation and reproductive function. This in turn will reduce the ovarian production of that estrogen and that progesterone, which impairs the uterine lining and decreasing the quality of the overall egg cells. So in stress management is definitely very, very important in conclusion. That being said, there are definitely very many ways that we can support stress management. So, techniques like yoga, counseling, exercise, and acupuncture can all definitely be great recommendations to explore when navigating stress. I will say emotional stress is definitely critical because even just starting to think about family planning can be stressful in itself. And then some ideas of mindfulness practices can include deep breathing, which is one of the best ways we can actually tap out of that sympathetic mode and into the rest or digest mode of our nervous system, also known as the parasympathetic division. When we're focusing on our breathing, we want to focus on being in the present, our body sensations, our thoughts, and our feelings as well. And then journaling. This can also be another form of mindfulness practices. I often recommend logging sleep, food, and then tracking menstrual cycles will also be very important for fertility. And I often recommend apps like Clue or Flow that are free and easy to navigate to track those cycles and symptoms. You can also add in with your journaling short and long-term goals and then any personal reflections that you have as well. So our last focus of the webinar will be on how to optimize reproductive health. And as mentioned, specifically here, we'll talk about comprehensive lab testing, how to track ovulation, and then evidence-based supplements that can be helpful in conception. So comprehensive lab testing, a crucial part of assessing fertility and overall health is through comprehensive lab testing. This helps us create a truly individualized plan, identify and address any underlying issues that may not have otherwise been identified, and then optimizing your overall chances of conception. So lab work is definitely individualized, but there are definitely a few markers that I'll be discussing that are important for basically every, if not most, fertility patients. So we'll start with inflammatory markers. So chronic inflammation can quietly disrupt our hormonal balance, ovarian function, and even implantation. So markers like C-reactive protein, also known as CRP or ESR, can flag hidden general inflammation. And these could be related to dietary processes, environmental, autoimmune conditions, or even certain conditions. So we would do further investigation if these tests came back negative because CRP and ESR are markers that will identify general inflammation in the body. So they're not specific to any tissue or organ. Next, AMH. So AMH is actually considered the most reliable marker of a woman's remaining egg supply, also known as ovarian reserve. Unlike many hormones, AMH is one that stays relatively stable and consistent throughout the entire menstrual cycle, so we don't have to test it on a certain day. But it is important to note that AMH tests for egg supply and not quality of the eggs. So this may be falsely elevated in people with PCOS due to the issue of releasing that egg. Next, a comprehensive hormone panel. So usually including FSH, LH, estradiol, progesterone, prolactin, and testosterone. So these hormones can help us identify how well our cycles are functioning, and imbalances can identify certain conditions like PCOS or luteal or follicular phase defects. And then thyroid. So even subtle thyroid dysfunction can impact fertility and even increase the risk of miscarriages. I like to run a full thyroid panel, including TSH, free T3, free T4, and antibodies. This is crucial for a complete picture. So I oftentimes find TSH coming back normal. And when we do further investigation with a thyroid panel, this can sometimes indicate low thyroid or elevated thyroid hormones and potentially elevated antibodies, even though that TSH is normal. So I like to look at the full panel for fertility patients. Now, nutrient levels. It's important to check in on certain nutrients such as iron and vitamin B12 to ensure that these stores are optimal for potential pregnancy. I find so many of my patients, especially females of reproductive age, are at some point of iron deficiency anemia. This is likely due to us menstruating on a monthly basis, so definitely very important to address. And then blood sugar regulation. Even mild disruptions in blood sugar can definitely influence hormonal balance, ovulation, increased miscarriage risk, and this is particularly important in individuals with PCOS. So I like to look in on fasting insulin, fasting glucose, even HbA1c, and even doing something like the insulin glucose challenge, depending on the individuals. This can reveal early issues, allowing for dietary, lifestyle, or supplement interventions. And then vitamin D, not just for the bones. So it modulates reproductive function and immune function. So many people, especially in our society, have low levels, even in the summertime. Optimizing vitamin D can actually improve our fertility outcomes, and optimal levels can help reduce complications, even in pregnancy. Again, very important to note that lab testing is individualized to the patient and their concerns and their overall health goals, but these are definitely a lot of the investigations that I would like to initially assess in a fertility patient. Now, tracking ovulation will definitely be very, very important. So it's actually much harder to get pregnant than we think because females have such a small window due to that ovulation. Making sure we understand our cycle and when we are ovulating will allow us to time our intercourse, and this creates the greatest chance of implantation and pregnancy. So tracking ovulation, there's three different ways we'll go through. So LH strips. These are the most accurate ways to track ovulation. The length of your cycle will actually determine when you start using them. So for example, if you have an average 28-day cycle and likely ovulate on around day 14, it's best to start using the LH strips on day 11 just so you don't miss that ovulatory window. And then cervical mucus. So cervical mucus will become a sticky egg white consistency at around day 14 of the cycle or when you ovulate. And then basal body temperature, also known as BBT, can be used in conjunction with the two ways above to track ovulation. How it works is that progesterone is basically a thermogenic hormone, meaning that it releases heat when it starts to increase. So this will slightly elevate body temperature by maybe zero point 0.1 or zero point 0.2. However, this elevation means that we've missed our ovulatory window because, as you remember, with our explanation of the menstrual cycle, progesterone is the hormone that increases after that LH surge. So these three ways can be very helpful in tracking ovulation in conjunction and making sure that you don't miss that window. And all this information is super, super helpful for timing intercourse. So when we time intercourse, the best evidence shows the greatest chances of implantation 2 days leading up to ovulation, on the day of ovulation, and then one day after ovulation, because sperm can live in the fallopian tubes for up to 1 day. Now, let's talk about a few evidence-based supplements that can be very helpful for hormone balance, egg quality, and overall reproductive health. So, a supplement that I like to recommend to every single fertility patient is a prenatal to take daily. One of the most important nutrients is folic acid. You want to aim for at least 4,000 micrograms to 1,000 micrograms daily. And folic acid is very important, especially in the first few weeks of pregnancy, because it's going to assist with closure of that neural tube. So, deficiencies can lead to things like spina bifida, for example. Another important supplement to consider for women is one that will help support egg quality. So, us female, we are born with a finite number of eggs. So, it's very important that we optimize the quality of these eggs. So, for example, supplements like NAC, CoQ10, L-carnitine, PQQ, and melatonin are super, super potent antioxidants that have been shown in the research to help improve egg quality through reducing inflammation and then oxidative stress. So we wouldn't prescribe all four of these supplements to one individual, but rather tailor the prescription to the unique individual. So, for example, if a shift worker working as a nurse may benefit the most from melatonin because this will help to improve the overall egg quality, but also help support the circadian rhythm and overall sleep quality. Next, if we have a individual that's diagnosed with PCOS, myo-inositol and berberine are definitely evidence-based supplements that can help support with ovulation and the reduction in insulin resistance. NAC can also be very helpful here as well. However, berberine is contraindicated in pregnancy, so very important to work with your healthcare provider on supplements that are safe. And then Vitex. This can also be used depending on what hormones are showing on lab work. So, for example, if someone has low FSH or lower progesterone, Vitex may potentially be helpful in modulating those hormones. And then if we're focusing on male fertility, CoQ10 and selenium can be great supplements for sperm quality and testosterone support. And then just a quick note, definitely very important to use only high quality practitioner recommended products. And the brand and the dose of each of these supplements is what's truly key to their success. So, when to seek care? Naturopathic support can definitely be beneficial at any stage. So, for preconception and just starting to think about the fertility journey, I usually recommend at least 3 to 6 months prior to conceiving is most beneficial, especially if somebody is transitioning off of a hormonal birth control and wanting to regulate cycles again. Typically, it takes 3 months after coming off of a hormonal form of contraception for those cycles to come back to normal. And then unexplained infertility or recurrent pregnancy loss are definitely important times to get fertility assessed and potentially investigate a underlying cause. And then lastly, naturopathic support can be very beneficial with assisted reproductive technology like IVF. And this can be in support with supplement interventions, lifestyle, diet, acupuncture, and so much more. So, in conclusion, naturopathic medicine offers comprehensive, individualized approach to fertility and overall hormone optimization. And really, by addressing nutrition, lifestyle, stress, and any underlying health issues, naturopaths help to support natural conception and improve reproductive outcomes. And this can be done either alone or alongside conventional treatment. Thank you so much for tuning in today. Have a great rest of your day.